Hi, my name is Dr. Robert Brannigan, and I'm a urologist and a male reproductive health specialist here at Northwestern Medicine. Oncofertility refers to fertility preservation, and it simply refers to thinking about fertility and preserving fertility before cancer treatment is given. We know that many of the cancer treatments, including chemotherapy, radiation treatment, and surgery, can adversely and in some instances permanently affect fertility and cause permanent and irreversible infertility in our patients. Fertility preservation should be offered to any patient who's been recently diagnosed with cancer. And so really, at the time of cancer diagnosis, when we're starting to think about initiating cancer treatments, we also want to think about having a conversation with the patient about fertility preservation. I think it's important for all of us to be vigilant and make sure that we're sharing the idea that fertility preservation is an important concept to discuss with the patients before we start cancer treatment. Making the patients aware of fertility preservation services that you might offer, or referring them to a proper specialist who has an interest in this area is really key. So at Northwestern Medicine, we're really fortunate because our colleagues in oncology understand the importance of fertility preservation as a key component of fertility preservation care. So our oncologists aren't just worried about the immediate cure of cancer, but they're thinking about life after cancer. They're thinking about survivorship, which is so important. If you look at men of reproductive age, over 3/4 of them are going to live beyond 5 years after their cancer is diagnosed and treated. So for most of these patients, they're going to live and they're going to want to live normal lives, as normal as possible. And for these patients, the chance to have children and have families, the biological children, biological families is really important. One of the things that we sometimes see with our patients with cancer is that when they present, either they're azoospermic, meaning there's no sperm in the ejaculate, or maybe they have difficulty ejaculating due to a lot of edema or swelling in their tissue or other issues. And the bottom line is that we can use the tools in our clinical toolkit that we use to treat other men with fertility issues to help get sperm from these patients who might otherwise be written off as not being eligible for fertility preservation services. So it's really important to speak with a fertility preservation specialist if you're finding a more challenging patient who is either azoospermic or who is not able to give a semen sample in the typical way through masturbation. The future directions for fertility preservation are actually really exciting. Kyle Orwig, a basic scientist at the University of Pittsburgh, recently published work where he took testicular tissue from pre-pubertal rhesus monkeys and removed these testicles from these animals and then reimplanted them underneath the scrotal and back skin of these monkeys. He allowed these monkeys to grow with these grafts in place, and then he removed these grafts and was able to successfully extract sperm from these grafts. And it didn't end there, because these sperm were then used to create an embryo through IVF, which resulted in the successful birth of a baby rhesus monkey. So this is all investigational work, but I think points to some of the possible future directions that may be relevant for humans down the road.